This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Love to take your phone calls on any subject that you might have in mind. Perhaps you've had a problem and you've been suffering and playing with it for a long time. You've tried, you've applied. Same old, nothing that really works. Well, here's an opportunity to find a different twist without drugs and surgery. Give me a call at 888-630-9625. That's 888-630-9625. Love to talk to you. It's an amazing fall day. Absolutely. We've actually 3-4 days that have been stunning outside. I hope you've had the opportunity to get out and enjoy them, go for a walk, go out into the mountains, really have some fun with your family and your friends. And, you know, but right now you have to listen here to Dr. Tom Roselle Live, because we're going to give you some excellent information on a very specific topic, one that affects way too many people in the population, and unfortunately more and more as each month and each year go by, simply because of, in many cases, lifestyle. What am I talking about? I'm talking about diabetes. You know, when your blood sugars get way too high and they sit in the bloodstream instead of going into tissue and working the way they're supposed to. Diabetic conditions are on the rise, not only all over the world, but particularly in this country, and it has to do with the things that we don't do to ourselves, and in many cases things that we do to ourselves. This Wednesday evening, October the 29th at 7:30 p.m. at the Roselle Center for Healing in Fairfax. We are right off the National Capital Beltway, and we're going to be presenting a topic, a lecture, a seminar, if you will, on diabetes. And to do that then, and to talk to you today in studio, Dr. Scott Lamp.
Good afternoon.
Hey, buddy.
Hey, how you doing?
Good. Interesting topic on a gorgeous day.
It certainly is. It actually means a lot to me, because this is probably the complications that took my mother's life back in 2004.
That I didn't know.
Yeah, so it's one of those type of things that when you talked about and things back and also Ageless Health, and you talk about taking a hold of your life, she lived the Queen's diet. She did not kind of listen to her doctor. She would go to another doctor to find out, well, maybe I could take this medication because I want to live my lifestyle. And she suffered the consequences of it. You
know, the unfortunate situation is that, I bring this up only because you mentioned the Queen's diet. And you go back to the time of the peasants and the royalty, and the peasants ate from the earth. They ate the vegetables, they scrounged, and so forth. And actually, other than infectious types of states, their health index generally was far better than the royalty living in the castles, because they ate the refined grains, they ate the tons of sugars, they ate all the things that they shouldn't. So these pictures that you see of people that are too fat and too big, and gout and diabetes and degenerative disease and all those things came as a result of that lifestyle. But here's the situation, a problem that is affecting so many people across the board in our country, and it's because we have lifestyles that are sedentary. We eat garbage. My mantra: sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, all the junk, right?
Right.
And we don't do anything about it, with the exception of, Doc, what drug are you going to give me?
Right. The quick fix. Sedentary is the other thing. That's the other thing you take a look at. We sit on our butts. I mean, I think the latest thing is the latest technologies we have, more and more and more are becoming sedentary. And that plays right into all this. And a lot of this is really functional management of what you're doing. It's lifestyle.
It really is. It's a lifestyle choice. And, patients come in to see you, they come in to see me and the practice, and we tell them, look, where you are right now is a result of the choices, the decisions, and sometimes in this situation, lack of choices that you've made, and has brought you to this point in time where your body's destroying itself. So let's get into it. We talked about diabetes there's many types of diabetes. There's type 1, type 2, diabetes insipidus, juvenile diabetes, and we can go on. They all have distinguishing characteristics, but the one that is growing exponentially is type 2 diabetes. We used to call it adult onset diabetes.
Right.
It's no longer adult onset. It's affecting our children at a very young age.
Yeah, because all the preservatives and all those types of foods and the sugar additives and all those other type of things are being introduced so far, so quickly nowadays that basically it's just leading into now that's, you got to change the definition of it.
So if you like your eyes, you like your kidneys, you want your heart to work, and you don't want your body to have any pain, this is really something that you need to spend a lot of attention to. And this Wednesday evening, the 29th, put it on your calendar, 7:30 p.m., come and visit and listen to what you really can do about this. There's actually a couple herbs that if you didn't do anything else except make a few tweaks and changes, there's an herb that is safe that completely does a better job than metformin and glucophage. And we won't talk about that right now. We might give you a hint of it towards the end, but it's absolutely true. Mm-hmm. Let's talk about the symptom presentation of diabetes generally. What do you normally see? What raises the flag? You got a problem here. Because the truth of it is that you can have a patient, and I'm throwing out numbers now, the top end on blood sugar levels is generally most laboratories is 100.
Right.
And even then, that's right. And actually, functional medicine says 75 to 85. Anything above that raises suspicion. And then we want to see something called an A1C hemoglobin.
Right.
And that tells us that's the kicker. That should not be over 5.6. Hits 5.7 to about 6. Now you're in pre-diabetic stage. You kick it over 6. Now you're diabetic.
Well, the hemoglobin A1C is important because sometimes the glucose is a point in time. It's right there then and it's done. And sometimes it can vary back and forth depending on the moment and how it's done and taken. The hemoglobin A1C is like a history of your blood work over 120 days, what the blood cell's been doing and interacting with sugar and the oxidation that's happening to it. And it gives us a really good clue. It's actually used to monitor diabetes treatment and therapy.
So what really is that a measure of? How would you explain it to a patient that says, okay, my doc wants me to have this A1C. I know that if it goes up or down, that's what I'm supposed to be doing. But what is it really?
Well, it's a I'm terrible at this.
Go ahead. I'm not even going to help you out on that one.
It's an oxidation. I'm going to go through that way. You've got to be tongue-tied here. But what happens is it oxidizes. The more the body or the red blood cell hemoglobin is exposed in the bloodstream to this, glycosylation, if I can say it correctly, happens over a period of time. And as it's exposed to it, it starts breaking down. And you can actually measure that by looking at a mature red blood cell and looking at it and defining it, and it gives us a number that we use, and that in turn shows us like how much it's been affected.
Yeah, now you got me doing it. Glycolation, that's responsible. It's the red blood cell and its capacity to transport blood sugar and take it into the system and increase oxygenation and so forth. The problem is that with the diabetic situation, it's that hemoglobin isn't able to. That's where the resistance comes in. It isn't able to receive the blood sugar. And so what happens is that this barrier forms, and that's where you get the term insulin resistance, and it can't get in. That's one piece, but it also that resistant pattern is also the tissue itself. Mm-hmm. And you have a receptor site problem, you can have a blood transportation problem is what we're talking about, and all these guys are a result of an inflammatory pattern that's due to the things that we're going to talk about.
And the inflammation itself blocks things too, so there's other forms of inflammation that you can add on top of this, so it starts stacking on itself.
Inflammatory levels come about because of injury patterns. They come about as a result of dietary patterns, because of emotional stress, all the things that we generally talk about, and particularly in diabetes, in a diabetic situation. And you have to distinguish. You have to distinguish between diabetes insipidus and what that really means, and the other forms of it. But unfortunately, the medical community just kind of throws a carte blanche at the thing. So patient comes in. Back pain. Patient comes in. My feet hurt. Patient comes in. I've noticed that my eyes aren't working the way they're supposed to. Patient comes in. Doc, I've got these dull headaches that just rage all the time, and they seem to be made worse of. How do you walk through the cloud?
Well, I think the one thing is it's almost like they walk things backwards, because you got to start off with, and I think the other thing when we talk about diabetes, we also talk about dysglycemia. Because even hypoglycemia kind of falls into this picture too, because dys means this dysfunction, glyce means of sugar in the blood system, and making sure those are regulated, either too much or too little, and that's what we're really kind of talking about here, is the combination of both these factors. So you got to take a look at it. Why is something fatigued? You got to take a look back from that. Is it fatigue? And a lot of it has the clues would be with meals. I think meals give you a real good idea about what's happening in your body. If I'm having problems, if I eat something, and as soon as I eat something, I feel fatigued afterwards, that's one of the first signs of insulin resistance that's there.
It's called a clue.
Yep, and it's clue. And then it goes back to, then you could also have, I eat and I feel a lot better. It perks me up. And so that could be a hypoglycemic aspect that's associated with that. So that's another thing it's talking about. Am I balancing my sugars correctly?
It depends on how long it makes you feel better for, because some people all of a sudden they get jacked up. They go and they eat something that's a quick-acting carbohydrate or sugar, and I feel great.
The quick fix. And the caffeines.
Yeah. The other end of it, they're sitting in the corner falling asleep and can't open their eyes. That's called a dysglycemic pattern or reactive blood sugar pattern, and we see way too many people that do that kind of thing, and they're constantly looking for that quick fix to try to keep themselves in a parallel that they can exist through the day. But your body gives clues on blood sugar regulation, and the thing of it is we ignore them until the point that then we start talking about metformin, glucophage, or injectable insulins, to regulate our system. And I know you're going to get into that in a very intimate basis, but let's talk about the pain patterns. Diabetic neuropathy. We see all the ads on television. You see these feet, right? And the nerves that they portray on television, they're firing, they're hot, they hurt. You can't even step on this stuff.
Right.
And it comes from diabetes. Why?
Well, first off, if you think about diabetes is actually increased sugar in the bloodstream, and what happens is things get sticky. And if they get stick and those blood cells stick together, they are hard for them to go through small little arteries called capillaries. And those capillaries can't get fed, and so sometimes you're not getting blood flow to those areas. As well as, it doesn't necessarily feed the nerve very well, too. So you can also get a nerve effect on it also on top of it. So you've got all these things jammed together. You've got these capillaries that let one blood cell go through at a time, but now they're all stuck together. They don't go. So what happens is now you're not getting blood flow to that area. You're not feeding it, and it starts to degrade.
The thing that we have to remember with a diabetic type of neuropathic pain is that it's often, in my opinion, more often than not misdiagnosed.
Right.
You have a patient that has problems with their feet. They have numbness, they have tingling, they have ache. My legs ache. They go in, the doctor sees, well, you're a little bit diabetic, and they say you have diabetic neuropathy. Not so much. See, and then they put them on all these processes, these medications to try to kill the pain and dumb down the feeling. And you have to distinguish between the two. If you don't, you're treating inappropriately. For example, we know that all the nerves from the lower back go to the feet.
Right.
And you can have numbness or pain or tingling or loss of function simply because the nerves in your lower back are overstretched, they're irritated, they're compressed in some way, happens to be parallel to a diabetic pattern or a potential diabetic pattern when you start seeing an A1C starting to rise, not full-blown. But when you have a patient that has a blood sugar, and I'm making numbers up now, right. Folks, remember, these are made-up numbers, of a blood sugar around 100 or 102. You have an A1C that's 6.1. So by traditional diagnosis, the patient is in a pre-diabetic or initial diabetic phase. But that should not be enough to put them into a diabetic neuropathic presentation.
Correct.
It hasn't been around long enough.
Right.
It hasn't killed. So there has to be something else that is in addition to that, and that's the distinguishing feature. You really need to know how to walk through the weeds, so to speak, to find out what's really taking place. This Wednesday evening, October the 29th, 7:30 p.m., if you have diabetes, or if you have someone in your family who's diabetic, or if your doctor said you're pre-diabetic and you want to beat the pattern, you really want to turn this nonsense around before it really gets to you, destroys your heart, your kidney, and, gives you diabetic pain that is for real, show up. Call us, 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend, and Dr. Lamp is going to really take the veil off this thing and show you what's happening, why we're having a problem, and what you can really do about it. Dr. Scott, this problem with diabetes, the drugs, the glucophage, the metformins, real quick, 30 seconds, we're coming up to a break. Side effects, give me 3 or 4 of them, that people need to be aware of. We're going to talk about when we come back.
105.9 FM and AM 630, Washington's Mall, WMAL, where Washington comes to talk.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. Call us. Love to talk to you on any subject that you'd like to know more about. We're talking about diabetes and diabetic neuropathy and all the changes that go along with it and so forth and so on. You know what? This is a problem that, unless it's genetically hardwired, that it doesn't take a lot of rocket science to turn it around. It's something that is very doable. It can be fixed. You don't have to suffer with it. But because we are slugs, meaning we don't get out and exercise, because we don't eat properly, because we stress like crazy, we're sitting on our devices, our electronic stuff. We go from our house to the car to where we're going, and then back to the house again. And subsequently, our body is telling a story that things are working very inefficiently. There is a medication, switch that around. There is an herbal preparation that is better than the medications of glucophage and metformin, safer, and actually it does a far better job, doesn't have the side effects. And if you want to know about it, got to come Wednesday night, October the 29th, 7:30 p.m., and we'll tell you about it. We'll tell you exactly what the problems are that are associated with it. But trust me, when it comes to these meds that you're taking, you're destroying your health, you're killing yourself. You know, one of the things I wanted to bring up, Dr. Lamp, and a lot of people don't think about it, we talk about neuropathic problems, but there are also skin problems and pathologies that show up on the skin surface. And we see these round, brown, circular, we call them aging spots.
Age spots,
right?
liver
Age spots, liver spots. They're actually blood sugar handling problems. Mm-hmm. The skin tags around people's necks, those little things that hang off, the kind of ugly people wonder, oh my God, where they come? That's a diabetic condition and sign.
The color change on the back of their feet coming up to their ankles, and you start losing hair along the aspects of your legs. And just thinking, how come I don't have any hair in my legs anymore?
Yeah, that's right. With that, one or two things, that can be that, but it also can be the nerves from your low back being crushed, and so that you're not getting stimulation to the skin surfaces. Remember, everything's run by the nervous system, and you've got to be able to distinguish between the two and all the other things that that are out there. And you're made to believe that this is something that happens to you. Well, it doesn't happen to you. You do it to yourself. My book, Health is a Do-It-Yourself program, mm-hmm. That's why these things come about, and we really have to take ownership and realize that we continue to get ourselves in a hole that becomes worse over time because, one, it starts with neglect, but then it starts with neglect, or ends with neglect, because we don't pay attention anymore.
Right.
Let's talk about, this will take us up to the midway portion of the show, but I want to talk a little bit about fructose and actually other types of blood sugars, sweeteners, and things of that nature. So we know that there is sugar, but the problem is sugar. Anything that tastes sweet to the brain, to the nervous system, is sugar.
Right.
Walk us through the whole little bit.
Well, fructose is in our diet all over the place. I think one of the things is you're talking about, like even table sugars, like half glucose, half fructose. And one of the problems with fructose is that it actually affects something called leptin, which is another hormone that if you get insulin resistance, you get leptin resistance. And leptin actually, if it's working appropriately, actually satisfies your hunger and actually gets into thermogenesis, which means kind of helps burn calories. But if that's blocked, then all of a sudden now I don't feel I still got the hunger and I'm not burning the calories as much. And then fructose has been known to actually block that. And so one of the problems with that is fructose does not stimulate the rise in leptin. It suppresses the signal. And so that's one of the problems it's in so many different foods. You take a look at your any type of your fruit drinks that are out there, high fructose corn syrup is there. And there have been studies and showed that people that are rats that were put on fructose versus rats who were put on like dextrose, which is regular glucose, one actually didn't really gain the weight, and the other ones did. The ones with the fructose diets were horribly in shape after the experiment.
Well, the problem is that when you're leptin resistant, it's because you're getting fatter.
Right.
And it's not because that you're necessarily fat on the outside, but that fat also goes to the inside. And we've talked about that before, where it's you can get a skinny fat person where all this, the inside of your body is now engorged with this bad fat, and now you got a huge resistance pattern that covers everything.
Yeah, but it also, with the fructose, those also increases your insulin and increases your triglycerides. It's been shown to do that too.
Absolutely. I mean, patients will come in and they bring in their blood work, and we see triglycerides are up, we see LDL levels are up, we see total cholesterol is up, but your
HDL down.
And HDL's down. But in the initial stages, actually, HDL won't be too bad. And so, well, it's never like that. I don't understand what's going on. And I look at them straight in the eye and said, how much sugar did you have last week before you did this test? And they said, well, not too much. How much is not too much? You notice how people are kind of vague.
Right.
Well, how much is not too much? Well, let's do it on a quantity basis. Let's start out with, did you eat it once a day? Did you eat it 5 times a day? Did you every time you go buy the candy bowl, you're grabbing something? How about carbohydrates? So don't think about that as sugar. How about, you got something that tasted sweet? What do you drink? Well, I drink artificial or
I just had one piece.
Diet Cokes. Yeah, I just had one piece.
I just had one piece.
The whole freaking cake. It's like, give me, okay, well, that's what happens. We talk
serving
about
size, you bet.
Yeah, serving size. You must be Attila the Hun. I'm not sure which. We're coming up to a break. We're going to talk about this a little bit more. We're starting to get some calls. We will take your calls at 888-630-9625. That's 888-630-9625. Don't go away.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in this absolutely gorgeous, beautiful fall Washington day. 888-630-9625, 888-630-9625. That's how you find us here. And by the way, if you'd like to get a hold of us off the air, it's real simple. Go to rosellecare.com. That's ROSELLECARE.com, ROSELLECARE.com, or call 703-698-7117, 703-698-7117. Ask to talk to one of my docs, and they'll get back to you. But that's also the number that you're going to call to register for this Wednesday evening's program on diabetes and what to do about it. And your host is going to be Dr. Scott Lamp, my guest today on air. Do that, and do it right now. Let's go to the phones. John, you've been waiting. First I thought I lost you because you were up there on the screen, and then all of a sudden, boom, you disappeared. So let's talk to you.
Yes, I dropped off and then I called back again.
Well, thank you for doing that.
You were talking about diabetes medicines and how that they tend to make things worse.
Indeed.
And I'm on diabetes medicines. I'm on 3 pills of metformin, glipizide. I take Lantus insulin, 38 units 3 times a day, which is a lot. Plus I take the Victoza.
How long have you been diagnosed as a diabetic?
2 years.
Okay, how old are you?
I am 55.
What's your weight?
205.
How tall? How tall are you?
I'm down 10 pounds and very proud of it.
Good boy. Congratulations.
Have another 40 to go.
Well, maybe. Let me tell you something about weight loss, and then we'll talk about what you're on and so forth. Weight has nothing to do with the amount of weight. It has to do with the composition of the weight. So what you do is, what we do in the office is, for example, anytime we put anybody on any kind of structured dietary detoxification, any kind of something that may produce a weight loss, is we want to find out how much muscle mass, bone, water's in the body opposed to how much fat. As a man, you should be between 10 to 15% ideally at your place in the game. 15 would be great, okay? So if you're down at that level, you can weigh 235 pounds. And if it's at 14% body fat, you're not going to have a fraction of the problems that you have. When I was in college playing ball, my playing weight was 218, 220, but I was 9% body fat. Today, I'm about 199 to 202. I kind of go back and forth with that all the time, but my body fat is about 14%. Big difference, but, I'm still within the limits. So that's all I'm going to say to you about body weight, okay? So Let me tell you about the side effects of, something as simple as metformin and all the other things, and I'm just going to give you the guys that are most common. Everything from headaches to causing cognitive dysfunction and blurring your speech, confusion, coma, nervousness, sore throats, fatigue, very profound weakness within the muscles. You can end up with huge anxiety reactions, which are very common due to blood sugar handling problems, and it goes on. Now, those are just the ones that we see constantly almost with everybody to some level or another. Then you go into back pain. You can go into your cardiac arrhythmias where your heartbeat slows way down, which is called bradycardia. You can go into urinary problems where you have pain and discomfort. Then you go into things of where you can't sleep, your bowels are irritated, and unfortunately, one that they don't talk about too much, it predisposes to certain types of cancers. And then, the list is awful. So, and then when you compound that with other things that you're taking, it intensifies and enhances the side effects of what's going on. Okay, now your turn. Talk to me. What do you want? What do you need to know?
Well, of all those medications, I know that when I run out and don't refill in time and I stop, I feel a lot better, but of course my blood sugar levels go through the roof, way over 200. But in feeling a lot better, in fact, the only symptom is that I start passing sugar through my urine, so I'm peeing all the time. Of all those medications, is there one that I should be looking to get off of first?
It depends on what your dietary patterns are. And depends on what your fatty acid metabolism. Let me tell you how the better answer to that is, let me tell you what I would do with you. First, I would check you. We would check you in the office for neurological impairment from any kind of injury or damage that took place even 25, 30 years ago that's had an effect in stimulating your pancreas to produce insulin, or the fight-flight system, your adrenal glands, to stimulate the pancreas, because the adrenal system is what's responsible for sending a message neurochemically to the pancreas to put out insulin. Then we would need to...
Is that a blood test?
No, that's structural. That's a neurological exam. That's finding out...
Like where they poke with the needle?
Nope, not even. We do muscle function testing. We do structural examinations. We look at the spinal system because you have 31 pairs of nerves that come off of that. So we're going to do back tracing. We're going to do sensitivity testing to see what nerve roots are involved. So for example, your thoracic area between thoracic 7 all the way down to, it depends on what we call an upshift or downshift in the nervous system, down to T10, thoracic 10, is going to facilitate those areas that we just talked about. So we're going to check structural motion. We're going to see if the nerves are being irritated. That can be treated by a combination of things, but manual manipulation and so forth. We're going to check your energetic field. We're going to check your acupuncture pathways. We're going to check your diet from not only what you're eating, that should be supportive, but what things that you may be eating that you're sensitive to, because those are the things that are going to cause the allergic responses within your body. And so we need to look at that. Then we need to look at, what are you drinking? How much of what are you drinking? Artificial sweeteners, diet sodas, diet this, diet that, because your body doesn't know the difference between an actual sugar and something that is sweetened. It tastes the same, so neurologically your body's going to do the same thing. It's going to react the same way because it's stealing things like chromium and B complex and zinc and E and along that nature. You put those together and, miracles happen.
I think some other things to add into the picture is also making sure the laboratory work that's done and really looking at things like C-peptide, what's left of the pancreas and the aspects that of the cells that put out insulin. Sometimes, too, that they're showing a little bit more, probably about 20% of all the people that are diabetic are actually adult onset autoimmune, which is type 1.5 diabetes, as they're calling it, and to see if there's an autoimmune disease that's starting to go on. So what happens, it creeps in slowly. So it's not like what do we have like juvenile diabetes, but adults can get this too. So you want to kind of roll that out and look at the inflammatory pathways.
John, you're doing a great thing. You're losing weight. That's what you need to do, but you're going to need somebody to guide you through. You got to increase your omega fatty acids very high. You got to get on B complex. You got to get on zinc, the things that I talked about, but you have to find out if those other things are involved. Just for conversation's sake, our continuing education programs that we're having in the office is absolutely no charge. It's just our gift to the community. That's what we do. Join us Wednesday night if you have the time at 7:30 at the office. Dr. Lamp will talk to you afterwards. He'll take you through it, and I can give you very specifically what action steps I would take if I was in your position. So, John, I appreciate the phone call. I'd love to see you this week. Barbara, how can we help you?
Yes, because this is immediate nature problem. What is your advice if it's my husband who's had carpal tunnel syndrome for several years? He's taken tests, and they finally confirmed that, and is sending him to several surgeons for a second opinion to whether to have carpal tunnel syndromes.
Okay, Barbara, real quick, how old is your husband?
82.
Any injuries or accidents over the last 20 years?
Oh, I don't think so.
Okay, so carpal tunnel comes about as a result, if it's a true carpal tunnel, it's the middle nerve. It's called the median nerve that goes through these 8 little bones in the center of your wrist, and these bones get torqued. They get moved out of position in a way that it causes that nerve to be trapped. So the thumb and the forefinger, which is where these nerves go, are the ones that have the most pain. You can't lift things. You're very sore. It throbs, that sort of thing. Now, the problem is it can come from, that nerve can be irritated from the neck, from the shoulder, the elbow, the wrist, all the way through. It can have what we call sometimes a double crush phenomena. That means that there's 2 areas that are involved along the path.
Or multi-crush.
Or
actually,
multi-crush.
More than that.
That's right. And so in my book, if your husband hasn't seen somebody that does our kind of work, if he hasn't seen at least an acupuncturist, then going to surgery without exploring those things is foolishness.
And Barbara, I think the end result with that too is if the problem is swelling and having problems and making an entrapment there, what's causing that in the first place? That's not being addressed by surgery.
So you have to know where it's coming. Just because the nerve is on an EMG looks like it's not transmitting properly does not mean that the answer is surgery. Surgical resolution in a carpal tunnel problem is they go in and they cut this fascia. It's like saran wrap or plastic wrap around the wrist. They free up the bony areas, and that's it. That's all they do. You're going to pay for somebody's car payment or a house payment. So the thing of it is that there's things to do before that can resolve it completely, also preventing it from going to the other side. Now, it's not contagious, so it's not going to drift to the other side unless, it has that type of phenomena, but that doesn't happen. If you have it in one hand, there's no history of injury, it goes to the other hand, it's usually coming from the spine, it's usually coming from the neck. We see these things constantly, and most of them, 90% of them, 95% of them, don't need surgery. They can be managed conservatively.
And the surgical rates are all that wonderful either. If you're looking at a 1 or 2 year follow-up, there's like a 40% success rate with some of these done.
So, Barbara, if we can do anything to help you, even if you'd like to come by Wednesday night and ask Dr. Lamb questions about this and bring your husband, we can take a quick look. Our gift to you, and we tell you if it was our family, what we would do one way or the other. Barbara, thank you for calling. I really appreciate it. Diane, how can we help you?
Yes, I've heard you talk about blood thinners, all right, and I just got a prescription Friday for one called Apixaban. I have bad circulation, PVD in my legs. I've had an ablation done years ago, and the other day my thumb and my another finger had gotten numb. It lasted for about an hour or 2. The Apixaban is 2.5 milligrams. I haven't started taking it yet.
Yeah, Apixaban it's a medication that they give you for blood clots, or when they think that you may be forming blood clots, and it's usually one of those things that, when they say you got tachycardia or that you have an atrial fib problem where, the atrial chambers of the heart are not moving the way they're supposed to. They give it to you because of, they say it's going to reduce your risk of stroke and so forth, and they don't want clots to go to your lungs, and, they usually do it after surgery. Did you have knee replacement surgery or anything of that nature?
No, I haven't had any surgery.
Well, then I have no idea whether there's so many other ways of doing this. I mean, if you want to thin the blood.
I did have the ablation about 10 years ago.
Yeah, no. I mean, in my book, if I was in your position, or if you were my wife, you would be doing all kinds of other things before you go on any of these crazy blood thinners because of the deadly effect that they have within the body.
Yeah.
Increasing your
that's what I've been reading about. I got on my computer and I got frightened thinking about it.
Yeah, absolutely. I mean, that's exactly what I'm trying to tell you. And it's you can cause a lot more damage than what you're trying to affect. If you want to do something that is straightforward, you don't know what to do, my suggestion is to you can see one of us, or just make an appointment with Sue in the nutritional functional medicine department. She'll tell you what to do. She'll help you through. She'll give you the right things to ask your doctor and so forth.
Yeah, he said it was safe because it was only 2.5 milligrams.
Nah, baloney. Okay. No, it's not safe. You looked it up.
How's your bruising, Diane?
How's my what, breathing?
Bruising. Do you bruise easy?
I don't know. Not now. I haven't taken it yet.
Okay, that's the thing you got to start looking for, too, because a lot of those things, it's, and how young are you, Diane?
Well, my legs, did you ask me about? Yes.
How young are you?
How young are you? Not old. How young you are?
It's 85.
85. So again, falls are a big thing when you're getting to that age. And one of the things is going to be, if you can put a blood thinner, boy, I tell you, it could be life threatening.
Okay.
Yeah, you don't want to mess with it. You smart enough. You did the homework. Don't do it. Diane, let us know how we can help you. Appreciate it. George, how can we help you, sir? We got a couple minutes.
Thanks for taking my call. Always a pleasure. I have a question on blood sugars. Kind of an old school gym guy. Really don't eat anything after 7, but occasionally, you're watching a movie, I've got to have something. So sometimes pineapple or an apple or whatever. What does that actually do to the blood sugars? Because I know it's a natural sugar, but it's basically categorized the same as sugar.
What it does, yes, I do. What it's going to do is going to crash your blood sugars. You're going to go into a hypoglycemic pattern, and then you're going to rebound your blood sugars in the morning, which you need to do. What time you go to bed at night?
I'm a late kind of guy, maybe 11 o'clock, 11:30.
What time you get up in the morning?
6 o'clock.
Okay, so you're going way, way, way too long without any food in your body. And your body's going to respond into a hyperglycemic pattern. You really need, if you're going to cheat at night, you need to eat some protein. And, a lot of our diabetic patients, a lot of our adrenal patients, a lot of our hypoglycemic patients, I tell them an hour before you go to bed, I want you to eat an organic hard-boiled egg. I want you to have a quarter cup of nuts. I want you to have 2-3 ounces of protein. And all of a sudden you see the blood sugars begin to normalize. Do not do carbohydrates or sugars at nighttime. If you do them, make sure you get a protein with them.
George, let me ask you, how do you sleep at night?
Off and on. I mean, it all depends. I'm in business for myself. You can answer that question.
From what Dr. Tom says, you're suffering right from that. Because what's happening as you crash down, the adrenals are going to come back and say, you know what, I have to support this body, so it's going to push sugar in, it's going to wake you right up.
George, we got to take a break, but please don't do that. Get yourself some protein at night or eat a little bit later, but get yourself a little protein. Don't do the carbs at nighttime. You'll find that you'll sleep better. Get some protein in your body. You'll feel a whole lot better when you wake up in the morning. You'll sleep longer at night. We're coming up to a break. Dr. Scott Lamp, my guest, your host this Wednesday evening. We're going to be talking about diabetes. Don't go away.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. My guest today, Dr. Scott Lamp, will be your host this Wednesday evening, October the 29th, 7:30 p.m. at the Roselle Center for Healing. Going to be talking about diabetes and all the implications. And if you show up, he's going to tell you about a very specific herb that works better than every other medication that is oral, from metformin to glycoside and so forth. And trust me, be there. You're going to learn a lot. This is not something to mess with. It's going to destroy your life, your capacity, your kidneys, your eyes, your brain, and all of those things. And so 7:30 p.m. And how you do that is you call us at 703-698-7117, 703-698-7117. Tell my staff that you'd like to be there with us. Dr. Scott Lamp will be your presenter, and Scott will take the time. Speaking of destroying your brain, Paul, how can I help you?
Yes. Hello, Dr. Roselle. Hello, Dr. Lamp. I had a question about marijuana, maybe as does it have any medicinal benefits? It's possible it might become legal in this area soon.
It has medicinal benefits. Now, you got to weigh the pros and cons. I mean, THC, dronabinol is a very potent, very specific drug, and it's used for pain control. And the reason that it's used for pain control, it has the same effect as codeine in the body. So the problem is it doesn't respect barriers. So women who are pregnant, who get the stuff in, will go through the placental membrane. It goes to the brain. Years ago, I'm one of these, I'm a child of the 60s, and we used to have the pothead type of personality. Well, that was a real deal situation. THC would form a crust around different neurological end plates, and it would build up. It has a half-life like many other medications, and the chance of it affecting many other systems are significant. Marijuana has been used for medical purposes, from treating glaucoma and treating asthma and urinary tract infections, and with some people weight loss. I don't know why weight loss, because there's the old screamers that when you've been using too much marijuana, you want to eat everything that's not locked down in the body. However, it supposedly has an effect to handle post-transplant patients. And why? You've got to remember, when you do a kidney transplant or something, there's a rejection factor. So marijuana, THC, suppresses the immunological system. It shuts it down, not shuts it down completely, but begins to dampen the body. So it's not without its side effect. It's not this great thing that's out there. Yes, there's other things that we do, like alcohol and so forth, that have problems. Now, if you're in a really bad place and you need something that is probably the lesser of many evils, this is probably a way you want to go. But the thing of it is that if you inhale it, if you smoke it, it's going to have another effect on the tissue, on the ciliary fibers of the lungs, and it's going to destroy those things. So, Paul, unfortunately, I don't have a lot of time, but I can get into it with you further. If you'd like to send me a note, go to rosellecare.com, and I'll get back. But there's the good and the bad and the ugly about this thing, so you need to know all of that before you make a choice. And, again, I'm very supportive that it is your choice. I have my opinions, and, if you write me, I'll let you know. We're coming up to the end of the program, unfortunately, way too short as always. Don't forget this Wednesday evening, 7:30, Dr. Scott Lamp talking about diabetes. I'll see you next week. Bye.
Take care.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
you.